Hello, and welcome to Virtual Investor Conferences. My name is Matt Lateplo, and on behalf of OTC Markets, as well as our co-host, Zacks Small Cap Research, we're very pleased you have joined us for our next live presentation from Syra Health Corp. Please note you can submit questions to the presenter in the box to the left of the slides. You can also view a company's availability for one-on-one meetings through the Schedule Meetings tab found on the conference platform. At this point, I'm very pleased to welcome the next presenters. M. Marin, Senior Analyst with Zacks Small Cap Research, and Sandeep Alam, Executive Chairman and President of Syra Health Corp, which trades on NASDAQ on the symbol SYRA. Welcome, M. Marin and Sandeep.
Thank you.
Thank you. So, Sandeep, let's start talking a little bit about the company and the outlook. We initiated coverage not too long ago, just a few weeks ago, and it looks like you're really poised for growth. Can you talk to us a little bit about the growth story?
Well, first of all, thank you, Marla, for having me here on this investor forum here, and I appreciate that. So the company has, when you talk about the growth strategy, I think we are going in two different directions. One is the organic growth, and the other one is going to be on through acquisitions. And currently, if you look at our structure, we are, we call them as business units. It is on behavior and mental health, digital health, and the population health, and healthcare workforce and health education. We also launched government solutions last quarter, which is very focused on the federal business, apart from the states that we are already working with. So our acquisitions will be one of the focus as well for this year. I mean, we're going to be starting out next quarter, making sure that, we are looking into specific businesses which kind of aligns with our business units and the products and services that we are already providing.
So if I understand you, there's an opportunity for strong organic growth as well as some strategic complementary investment possibilities. Can you give us a little bit of the background of, some of the factors that you expect, not specific to the company, but for the overall opportunity, the industry? What are some of the factors that you see that are driving your opportunity and the opportunity for the industry overall?
No, absolutely. There are. If you see, we have 5 units. We call it as very specific into the behavior and mental health, and all the other 4, as you see on the screen. We have Serenity. Serenity is one of the mental health app, and then the population health. We call them as our flagship products and services that we're providing, and that's going to be. We have a great major market opportunity in that, and that's how we are right now. We have launched and going to be growing into this. Especially, I want to talk about Serenity. Serenity is evidence-based, AI-backed, and which enables a continuous monitoring of our members. And also the intervention is by technology, and prevention is a very big thing. And that's how we differentiate in the market, how we are approaching the mental health. It is a conversational AI. It's AI backed, and we are engaging users while understanding the sentiment and also showing empathy. And also we actually, through this app, we are actually we specialize all these interventions and bringing this a therapist through our telehealth. So it's a combination of prevention, and also we are doing the telehealth where we're bringing access to the therapy in less than 48 hours at any. So that is kind of one of the we call it as our flagship product right now, and that's how we are doing. And also we're looking at the special mental health conditions, right? I mean, especially one of the most advanced ones are like the PTSD, right? The post-traumatic stress disorder, especially for the veterans. I'm just giving as an example. And also we're looking at the comorbid conditions like obesity and mental health. So there's so many type of mental health conditions. So we are bringing that speciality and customizing our tool as on the prevention side, but also access to the specialized therapists. So for these particular mental health conditions, that's how we are kind of seeing a big growth opportunity in this market for that. And the second one is the population health. And the population health, we have deep expertise, especially on the, especially with we have a lot of data scientists and epidemiologists, and we're looking at the public health data and trying to bring some insights to inform public policy. And also we have a lot of data and analytics as one of the service and and also a platform that we have. So these are probably the two we have, and this is how we will be driving our business and also looking at the great opportunities and potential in this market.
So you mentioned data and you mentioned AI. Can you talk a little bit about whether you see AI as a growing resource within this overall space?
Yeah, absolutely. If you, I want to talk about two things. If you talk about the overall, our drive growth in this overall industry, I just want to talk about our beginnings to start with, right? And I want to address the AI too. We started with a major contract 2 years back especially on the healthcare workforce, with a $17 million contract we got for NDI, which is a neurodiagnostic institute. It's in the state of Indiana. It's a government hospital. It's a psychiatric hospital, and we absolutely, that's our beginnings, and we saw a lot of shortage in the healthcare workforce side, and now today. We have fulfilled those contracts, and we're still continuing, but we have expanded into more than 16 states right now in providing that and in the same kind of service. And coming back to the other from a growth and AI in specific, for us, AI is expected to continue to drive growth. Each of our products are AI backed, which makes us very competitive in this marketplace. And also we are absolutely committed to the response, as in sense of responsibility wise for the use of the AI, and absolutely we will support any AI regulatory frameworks to ensure, from our side is robust testing of AI driven models, inclusion of robust security measures, equity and bias kind of mitigation, and also, of course, education for the healthcare. So currently, all of our healthcare, when it comes to again to the responsibility side, we are ensuring all of our AI applications in healthcare remain safe, effective and ethical, and that's going to be the important thing for us. And let's not forget that it comes with a lot of savings, and that's one of the reason AI has a value to it. What it is now, we are actually projecting technically $150 billion of a kind of a savings, where this AI applications and this technologies are being utilized. Again, our products right now, Serenity and our EMR system, currently we are definitely using AI for that purposes, and we're going to be expanding into other products as well, especially when it comes to AI.
Okay, so all of that said, you're a relatively young company, and yet you've had a significant amount of new business activity in recent months, which would suggest that the use of AI and the use of some of your tools are definitely finding traction within the marketplace. Can you talk about some of these new business wins?
First of all, we're very, very extremely happy for the contract wins. And you're already seeing it through our press releases weekly. And this goes back to, it reflects to our strong foundation, strong kind of platforms, and that we have built. And we, when we launched this product and services, part of this business units, what you see under behavioral and mental health or digital health, population health, we have seen the unmet need. And that's how we have absolutely, worked towards it and launched these products. And we see the wins now. We see the results now, right? With all these products and services, and we absolutely are very happy with this, with how we are driving our business through these products and services into the market. And definitely, I think 2024 seems to be going to be a magical year, is what I'm going to call it as. And there's going to be a continuous. It's definitely, as I say, it's a fast-growing company, but there's going to be continuous wins, is what we're going to see on all these products and services that what we have.
Thank you. And also, one of your latest contract announcements was a partnership for a federal-based contract award. Do you see that as potentially, a milestone? And can you give us a little bit more color on how that contract works?
Yeah, no, absolutely. It's a great announcement. We have started our government solutions business in the last quarter, which means doing business with, focusing on the federal business side. We are already working and in more than 17 states, providing all of our products and solutions from a state side, state government, but on the federal side, it's a great beginning. Our recent partnership with Caduceus Healthcare, it's a partnership to for a specific contract that we have announced in the for the federal initiative to the provision of multiple influx care facilities. It's ICF basically, and this contract is going to allow us in a partnership with Caduceus Healthcare from services which fall under. By the way, this one falls under the IDIQ, and the range is from facilities operation to personal care. But we are going to be focusing on especially on the professional services related to case management services. We'll be focusing on the medical services, behavior and mental health services, and education services. So these are our specialized services in the healthcare side that we'll be focusing with Caduceus. And we'll be start expanding and trying to look at the task orders, and we're going to be announce them as we receive them. And also, I just want to also mention we have a very great team that we have deployed for federal business, especially, and we're looking to expand into a lot of partnerships and also teaming agreements with a lot of companies. And apart from trying to be the primes with a lot of these opportunities, we are right now attempting. Currently, we are also looking at the companies who are already serving health and human services. CDC, NIH, Department of Defense, and a lot of other agencies. So we're looking into those opportunities there. And also, by the way, we are looking forward for two major contracts and waiting for the results for that, which is the MSQ2NG and the OSS, which is one of the IDIQs. So this particular, especially in the federal business, there's this contract size are pretty big, and there's lots of opportunities that as a company that we absolutely fit in providing the services that products and services that we have.
So you talked a little bit before about your team, and you've already established an infrastructure, a team of professionals. You've launched some products. It seems to me that continuing to execute on your growth strategy is not going to be a terribly capital intensive process. You've got most of the tools in place already. What are your thoughts about that?
No, absolutely. We are a high margin company and a fast growing company in a combination. So our investments when I say a high margin company, that definitely the investments what we are making, we are very strategic with that, and we are already made those good investments, and we are very conscious about how we are making investments in certain business units, certain products and everything. And definitely it doesn't require in most of the cases high investments into this one. So I think we are greatly set up, and again, more importantly, we are very conscious about how we are putting our investments into this one, and making sure that we are trying to come up with this products and services which are of course the high margin kind of thing, and that's what we have currently. I think we are pretty settled with that in all of the business units what we have launched, and I think any more capital expenditures and any more investments in the future is going to be for purpose of growth, and also for acquisitions kind of investments what we'll be looking for in the future.
Okay, and in terms of the background, the regulatory climate, the potentially changes in attitudes amongst public and private healthcare and medical professionals. How do you see that all playing into supporting the growth story here?
We are looking into we have a great team members. We have as I said, we are a high growth company, especially improving healthcare and one of the things that we are looking into making sure that our story, what we have, and the structure what we have built, and we want to connect with our shareholders. We want to connect with our existing and the new shareholders to come in and exactly see what we have built, and also with our current. We have a great team. We have a high quality culture at Syra Health, and we have a very strong work ethic. And that's kind of the company that we're building over here. But again, I want to kind of make sure that as a company, we want to connect to our shareholders. And new and of course our existing shareholders, and it's very important for this external audiences to making sure that they're able to see what we are doing, and that also comes with a lot of great communication in the future. We want to use these kind of platforms and these kind of channels to go back and connect on a regular basis, and that's what we are anticipating, and that's what we are going to do to make sure that as Syra Health and the things what we are doing, we want to make sure that it's been told, a great story in the market, with our shareholders and all. So yeah, that's what we are looking forward for.
Okay, and lastly, before we go to questions, is there anything else that you think perhaps people listening to this presentation should know about Syra Health?
Well, it's a fast growing company, a great healthcare company, and we have put in a great structure, and we are looking for we're looking for great opportunities in this market, in this space. We are connecting with our right now. Government is one of our primary customer right now, but we're also like to expand into life sciences companies and payers and providers, and bringing some great value to these. So we are definitely we are in a very fast pace and a fast growing company. That's what I would like to say, and also definitely looking for the great support and for Syra Health, from external audiences, which are going to be investors and also our shareholders.
Great, thanks. Okay. We have some questions here, so let's go to questions from the audience. Can you discuss your revenue model on how you acquire clients, and are you replacing existing service providers or generating new demand?
I'm sorry, can you repeat that question, please? I just...
Yep, it's multi-part, so let's start with the first part. Can you discuss your revenue model and how you acquire clients?
Yeah, so we have if you talk about a specific products, that's one revenue model we have, that is through licensing. For example, if you take a Serenity app, we have a membership fee for that, and also in a combination of telehealth, which is services. Then you have some products like a EMR, again, a very licensing based kind of model. But then we have population health, which is a combination of services. So our revenue models are kind of different for products and services. That's what we have. And also, for example, I want to also direct to the healthcare workforce, which is also a very good, very service model. So our revenues are kind of categorized and divided based on products and services across the business units what we have.
Okay, and I think the second part of this question is, are you seeing now with your new business activity, are you essentially replacing existing business, or are you generating new demand?
No, we are absolutely generating new demand with our things. And again, as I mentioned, we have all our products and all of our services we have launched based on a lot of market analysis, and we are focused on a very unmet need and a lot of demand in the market. And that's one of the reasons that it has become a pretty much what do you call, if you see all our wins and everything, it has become a great opportunity for us in this market, in deploying these and meeting the needs of this with this all our customers that we have.
Okay, and do you foresee any challenges with hiring and maintaining the level of staff that these new contracts will demand?
Yeah, so that's a great question. Actually, I wouldn't always going to go back and say that, since we one of the business unit we have is healthcare workforce. In fact, we have done above and beyond and have some great. We are continuously winning in that space, which means that we're able to hire people for our customers in that business unit. But which also means that we are very strong in our recruitment, and we will be able to bring great talent, and we already are. And I don't see a foresee. Of course, there's going to be challenges. In sometimes if you talk about specialized type of talent, it becomes a little bit complicated. But I think having so many years of experience in generally with all of our in the past, and also in the healthcare workforce already, and we are very successful in that. I think that's going to reflect into able to deliver, hire people, including some complicated hires. So I think we're very confident on that. And currently, so far, I don't think so. We are. There are challenges. Again, I wouldn't say that absolutely is 100%, but I think we are able to. We don't see any issues of hiring the talent and deploying this, and we're able to meet the demand.
Okay, and do you have a date for your next earnings report?
I think in a next couple of, I would say next couple of weeks. I think actually it's any time that we should be able to announce that. So at least the date and everything. So it's pretty much any time. So yeah, I don't have a concrete date yet, but it's any time.
Okay, so we're coming up to, we're already hearing a lot of news about, the election, the upcoming election. What are your thoughts about how a change in administration might impact the company and the company's growth story if we, end up with a Republican government versus what we have now?
Well, especially in healthcare, the show has to continue. It doesn't matter which government it is. It doesn't really matter. The systems have to be in place. The people have to provide the care, and the kind of the business we are in, the show has to continue, right? Yeah, there could be some challenges, some funding in certain areas, maybe, but at least from our company and the things what we are providing right now, and government again. Also, I just want to make sure yes, it is a primary customer right now with all the government, and it's being funded by federal and state. But we also are focusing in the private sector as well, which is the pharma payers and providers as well. But again, we all of our services. As I said, the show has to continue, and the systems have to continue. The people have to continue to provide the care and also participate in this, and making sure that we continue the business, and also. I don't believe that it's going to affect a lot with any administration change. So yeah.
Okay. And can we talk a little bit about, specifically 2024, the next several months? What do you foresee as the growth drivers for 2024, and also, the milestones?
Yeah. So we have some very, I would say, aggressive, big plans, and we want to stick on to that. We're heads down with that, and we want to make sure that we grow this company. I call it as a fast pace, and we are committed to that. We have great experienced people, including myself. I mean, my background and everything. I've been in business from past more than 20 years, and we have our CEO too, Dr. Deepika Upalanchi. She comes from a very great backgrounds, and we have other team members who have great experience. So, and the team is a super important thing here, and we are committed to grow this company. And looking at the 2024, going back to your question in specific, we are looking at a high, definitely. I can't just throw numbers there, but we are looking at definitely from year to year. You will be seeing some high growth, including this year, which also means meeting. We have set our bar very high, and which also means that meeting those milestones, and we are very confident that we'll be meeting those milestones for sure. And definitely, we are set. We have set some great targets for our team members, and including ourselves as management, and we are looking towards that to kind of reach those targets and meet those targets. I'm sorry, and yeah. So yeah, we are looking for high growth for sure. Definitely beginning for this year itself.
Okay, great. I think we're out of questions at this point. So before we end the presentation, is there anything else that you feel, we haven't gotten to discuss that you'd like to make sure the audience is aware of in terms of, Syra Health and what you foresee?
No, first of all, thank you for this opportunity to able to present, and more importantly, this was an important opportunity today, actually, because this enables me to connect to, a lot of investors and shareholders and everyone, and definitely, I would like to continue these conversations, and because we are looking for definitely a great support. Being a public company, it is comes with a lot of responsibility, and we want to make sure that we deliver what we are promising, and that also means that we want our shareholders to be part of our team, right? Which also means we're looking for a big support there, and we will continuously make sure that we will provide a lot information on a continuous basis, because I would like every shareholder to know, how are we driving business and how we are, moving forward with our company. So that's all I would like to say, and I really appreciate and thank you for this opportunity again.
Thank you. Thank you for your time, and thanks everyone for participating.